Okay, so LASIK is an outpatient procedure that we do to reshape the cornea, which is the very front surface of the eye. If you were to touch your eye, you would touch your cornea. And we correct nearsightedness, farsightedness, or astigmatism with that, and reduce patients' dependence on glasses or contact lenses. Elizabeth had a very interesting description of her experience when she said that it felt like there was a fish sucking on her eye. What she's referring to there is that part of the procedure where we're actually creating that flap that we mentioned, okay, that does require fairly high pressure on the eye to place an apparatus that will create that flap. There are several ways to create the flap. Traditionally, it's done with a very high precision blade system. There's a newer system called the intralase, which actually uses a laser to create the flap, which is what we do here at UCLA, at Jules Stein. And we have found that it's a more precise and predictable way to produce that flap. The rest of the procedure really doesn't have that pressure feeling on the eye. That lasts for about 30 seconds. The rest of the procedure involves some rinsing of the eye with fluid and the patient watching a red flashing light during the actual laser part of the procedure. It's a very benign procedure to go through in the sense that the patients don't feel anything sharp on the eye. The pressure is really the main aspect that's a little uncomfortable. The procedure itself takes about a half an hour to do both eyes. Having said that, we do like the patients to go home, keep the eyes closed for about 3 to 4 hours after the surgery because it helps the flap to heal properly. So in general, we like patients to be off from work for the rest of the day of surgery. When we see them the following day, 99% of the time, their vision is excellent. They drive in, themselves that morning and go right back to their normal activities that day. So one of the very common side effects Elizabeth actually alluded to when she mentioned she had that sandy feeling in her eye. Pretty much everyone has more dryness in their eye after LASIK. That typically lasts on the order of 3 to 6 months. It's more common in women, especially postmenopausal women, and can persist for up to a year. And Elizabeth mentions actually in the video that it took about a year for her eyes to get back to normal. I think she's referring to that dryness issue, that she had some sensation of dryness out to 1 year, which is not that uncommon. I think it's important for you to feel very comfortable with your surgeon, for you to meet your surgeon prior to the surgery day, and for you to feel like that you're being taken care of to the highest level of care, in the sense that issues like sterility and recalibration of the laser are taken care of. Certain centers tend to do a very high volume of surgery, in which time there may not be enough time to do all these things. And I think that learning what centers take the time with the patient to double check and triple check numbers and pay every attention they can to safety and sterility is really essential.